Med Talks with S, Decoding Family Planning.
Ability of an individual or a couple to decide when they want to give, when they want to conceive, deliver, and space their children.
Exploring family planning as a joint effort between partners.
Generation, people don't have partners.
Yeah.
But they have multiple partners. It's possible.
Yes, very possible.
So it's you to decide.
And the varieties of family planning methods.
For female condoms, it's advantageous because you can keep it in even hours before the activity. Yeah. The pills are the best for anyone who doesn't want to be pricked or prodded. So for males, vasectomy, they say as long as the lady doesn't know the male has done vasectomy, she'll still get pregnant. That is the joke. So
Hi everyone, and welcome back to Med Talks with S. Good morning, good afternoon, good evening, depending on the time that you are watching this show and depending on the place where you're watching us from. My name is Njoki Esther, bringing to you Med Talks with S. Welcome back to our continued viewers, and if you're new here, welcome. We are glad to have you. This is a show where we break down the medical jargon into simple, relatable, and consumable dosage for you. Guys, today I am so excited. First of all, because of the topic that we have today that we are decoding, and secondly, because of the amazing guest we have on studio today. Our topic today is decoding family planning. That would sound basic and that would sound not so wide, but technically speaking, that is so broad. But as I always promise, we are going to break it down into very simple and relatable and consumable dosage for you. In our platform today, we are having this amazing guest who is a medical doctor who has been practicing in obstetric and gynecology department, and so this is the right guest for us. She is Dr. Sly, and I'm so excited to welcome her to our studio. Karibu sana, Dr. Sly.
thank you.
How are you feeling to be here? And maybe you can introduce yourself further.
So my name is Dr. Sylvia Nyambani. I work in a county referral facility in Kenya. I'm a medical officer in obstetrics and gynecology department.
Yeah.
So I'm happy to be here. Thank you for inviting me here. I'm anxious but happy.
Amazing. Thank you so much. Thank you so much for allowing yourself to be used in this show. Be sure you're going to love it here. And we are glad that you have accepted to come to this show and share the vastness of the information that you have that is needed out there. So karibu sana.
Thank you.
And feel much at home.
Thank you.
So Dr. Sly, that is how we are going to refer you in this show. I hope that is okay with you.
No worries. It's okay.
Thank you so much. So, Daktari, today we are having a very interesting topic. We want to decode family planning. We didn't want to give this topic a jargon name or something. We want to bring it just as it is. And I know this is a topic that would sound very basic or very shallow as I speak or as I call it, but then to you I know it could be very broad, but then we want to bring it down to our viewers in a manner that is well understood to them. Yes, and as we start off, there is something that we always ask our guests, and we are going to ask you too. So we want to know, if you were not a doctor, what would you be?
Okay. When I was young, I wanted to be an engineer, but somehow I found myself in this profession. And so far, I'm actually enjoying myself. So maybe it was fate. Who knows?
Maybe it was fate.
Yeah.
And there is a guest that we once had who said that during the year that they did the KCSE,
Yeah.
the exam was fairly easy, and they got to score almost everything, and fate took them to the medical medical fields.
It happens.
It happens.
Yeah.
And okay, amazing. So, Dr. Sly, in almost all the occasions when we talk about family planning, what comes into the mind is preventing a baby from being born. And maybe you can tell us from a medical perspective, is that all about family planning, or what exactly is family planning? We can start from there.
Okay, so what is family planning? It has when we look at the scientific name, it has a very big definition. So the World Health Organization defines it as a ability of an individual or a couple to decide when they want to give, when they want to conceive, deliver, and space their children, when they want to get their children, right? But family planning is not about just babies, right? We also, other than preventing pregnancy, we have sexually transmitted diseases, right? So family planning also helps prevent that. The examples like condom is a form of planning. It helps prevent sexually transmitted diseases. Also, some of the components of family planning help to protect you from some medical conditions, like even acne. If you have acne, which is a skin condition, you can use pills. They'll help you. Yeah, so it's not about just preventing pregnancy. Yeah.
Okay. Oh, that's interesting to hear.
It is, but majorly, the major role of family planning in all aspects of health is preventing unwanted pregnancies. Yeah.
Unwanted pregnancies.
Or planning for a pregnancy the time you're comfortable getting a pregnancy. Yes.
That the second part of the definition sounds actually better.
Also unwanted.
Unwanted gives it a touch of evil.
Okay.
But yes, so that is the major role of family planning.
Yeah.
And I know that out there, there are so many myths, there are so many misconceptions that people talk about. There are so many advices that people give each other outside there as far as family planning is concerned.
Sure.
Especially on what is best, which family planning is best, is it even okay to use family planning and all that. And that is what we want you to decode in general. So I don't know where you're going to start with that, but I know you know where you can be able to start with that.
So I can start with family planning has to be a joint effort between the male partner and the female partner. You sit down, decide, yes, you don't want a child right now, you need to do form of family planning. We encourage both partners to actually come to the facility. We discuss the different methods we have. Then, based on how they know each other, we decide this is the best method for us as a team. Because it's all about team.
Yeah.
Right? So, depending on the different methods now, we continue from there. So, some of these methods are like, we have the normal one, pills. Everyone knows them as pills.
Yeah.
But there are different types of pills. We have, I'll go into some bit of medical words, kidogo. So, everyone knows, almost all ladies, if you ask them, they know pills. Because you have to take them daily, right? So, there are different types of pills. There's the one we have called, it has combined oral contraceptives, which has two hormones, estrogen and progesterone. So majorly these are the hormones which are responsible for the menstrual cycle, and they're the ones which help us to inhibit or to prevent pregnancy. Yeah. So the combined oral, Zamani, we used to have called Femiplan. I'm sure everyone knows Femiplan.
Yes.
Yeah.
Everyone
so that is
in our age.
Yeah. But right now it's not in the market anymore. So the newer forms of the combined oral contraceptive, that is one of them. The other type of pills, we call them progestin-only pills. But those ones we majorly use them for breastfeeding mothers. So the pills are the best for anyone who doesn't want to be pricked or prodded for family planning, right? But the issue with pills, people tend to forget I have to take them daily.
Because they come with a burden of you have to
Daily.
take them daily.
Yeah, you have to take them daily and at a certain time. So if I decide I'm taking them at 10 p.m., it's every day at 10 p.m. I have to take.
You have to do an alarm.
Yeah, a reminder that I have to take pills. Many people tend to forget. So that is why it's a good form of family planning, but because of people's habits, it tends to be not as effective. That effectiveness yake is 99%, which is actually very effective. As long as it's taken accurately. The issue is accuracy of taking the drug.
So that means if you choose on pills, you'll have to go with pills all the way.
No, you can decide pills are not for me and then I can change to another drug.
I'm asking for the time you have chosen pills.
Yeah.
That's a daily thing.
Daily thing for a whole month. Once the pills end, I go and replenish. So it's daily for the rest. If you decide it's for the rest of your life, it's for the rest of your life.
What happens if you skip a day?
So what
How
you
do you
recommend,
catch up?
What you recommend, as long as you have noticed you have skipped, you take it as soon as possible.
Okay.
But you don't make a habit of skipping it. The more you skip, the more effectiveness it goes. It becomes less effective. So it's all a matter of I have to remember I have a drug. I need to take it every day for 21 days or 28 days, depending on which pack you're using.
Okay.
And then once the pills end, I recycle. I buy more.
So this is irrespective of whether you are sexually active or not.
Yes, irrespective of whether you're sexually active or not.
Okay.
Oh no, not really. If you're sexually active, but now it has to be constant daily because you have a partner, right? But if your partner is, let's say, abroad, you don't need to take pills because you're not active. Okay.
Abroad sounds far, but we can talk about
long
about
distance
long
relationships.
distance, weekend meetups and such.
But now if you know they are going to come for over the weekend and there's going to be some sexual activity, then you'd rather take the drugs constantly. So that by the time you have that sexual activity, you're preventing a pregnancy.
Okay.
It's not, you don't take them when you're going to have intercourse. You you take them constantly because you even if ako Nairobi, you're sexually active because they come over the weekend.
Sure. Okay. That almost brings me to the emergency. Before we get away from the pills, the emergency pills. Would you talk about them?
Are very important, especially if you have had unprotected intercourse and you're not on any form of contraception and you don't want to get a pregnancy, right? But majorly we prepare them for post-rep cases, or if we have a mother who is HIV positive, we're trying to prevent a pregnancy because of the risk of transmission to the baby, right? But in our generation right now, e-pills, we call them e-pills, emergency pills, they're all teenagers. As long as you've had intercourse, you buy them, you take. We don't recommend taking them as a form of contraception because they're not as effective as maybe the normal pills, right? And then they have their own side effects. Okay. So one of them being, because how it works is by slowing down transportation of the egg. So it doesn't reach where it's supposed to reach on time, so it won't be fertilized. But then the issue comes when it has already been fertilized and we have slowed down transport. That is why you see an increase in ectopic pregnancies.
And especially among young people.
You see 18-year-olds, 19-year-olds, they have ectopic pregnancy because they pop them as normal pills, but they're not normal pills.
So at this point, especially when we are talking about those are the P2s.
Yes, P2s.
Yes, that's how we know them outside here. The P2s. What would you tell the young people, especially people who will constantly use the emergency pills? And you're already saying they are not very, very good, and because they have some of those side effects like the ectopic pregnancies, which are not also very good.
So for the young people, as long as you know you're sexually active, I'll advise you just try and find a long-acting contraceptive method. It's safe for you and it's safe for your lifestyle. Yeah, because no one, if it's a injectable 3 months, no one will know that you're on family planning.
Yeah.
You can. I'm not encouraging misbehavior, but for your own protection and your safety, it's safer you do long-acting contraception until you decide you want to get a baby. Then now we can reverse. Yeah.
How many times should one take the emergency pills per year? I'll tell you why I'm asking you that question. Yes.
Okay, there's no recommended time that you can say at once per year. Though we advocate for as minimal as possible, but because you can't predict when you're going to be having unprotected intercourse, right? But we try to advocate as minimal as possible. Yeah, I know the room is saying at least 3 times per year. More than that, you're at higher risk of the complications like ectopic pregnancy, but there's no specific time, no specific number that if I've taken more than 3 times, I cannot take it.
Okay.
The only thing that you don't do those is per the cycle. So if I have, and it has to be within 120 hours of unprotected sex, that is like 5 days, right? But the earlier the better, because once they're pregnant, the egg is fertilized. There's nothing it will do. Yeah.
Okay.
So as long as you've had so even if you've had it today, and then next week you have another one, you can take, but for your own safety, I wouldn't advise it.
Okay.
Yeah.
I was asking that because I had a session with some young people somewhere, and it was interesting to hear them say like they can even take that pill even 4 times a month. 5 times a month, like as long as they have had unprotected sex and they feel like they could be getting pregnant. I was even asking them, is it even possible? Why would you think you would get pregnant 5 times in a month? Yeah,
because they don't understand what happens with the normal
body.
reproduction, right? But now they're not asking, when they're taking they go to a chemist, they say give me P2s, and then they're given. No one will ask them, are you taking P2 so much? Or no one will advise them like let's try another form of family planning. But it's like, as we've said, because it's working, it's impairing the transportation mechanism. Eventually it will cause some unwanted effects eventually, but it's not an effective way of preventing pregnancy. Yeah.
Are the other methods of preventing pregnancy allowed to children below 18 years? Because that could also be the challenge.
So what happens, remember in this day and age, we have teenage pregnancies, right?
Yeah.
Teenage is between 10 and 19 years, right?
Yes.
So if as mothers, let's say mothers, we see that my child is at risk of getting an unwanted, because now that is an unwanted pregnancy. Yes. You can actually take them to a healthcare provider, the parent together with the minor. You discuss the different types of family planning. You explain to the child, okay, the sexually active teenager, because not all of them are sexually active. The forms of family planning we have in the presence of the parent, right? Once they understand and they choose the method, the parent has to give the go-ahead that I want my child to get this form of family planning, because I'm seeing if I don't do this, in the long run, I'm going to have an unwanted pregnancy. And remember, teenage pregnancies have higher risk of the mother even dying, because they're poorly developed, so they have high risk of high pregnancy complications.
True.
Yeah.
That's an interesting one, because I don't think it is as easy as you're saying.
It is not easy, but then remember, that is why we have to educate the masses. We have to educate the people that family planning is not about just preventing pregnancy once I get it. It's about even before I conceive, and I'm seeing my child is risky, has risky behavior. Why would I sit and wait for her to get expectant when I know I have a way of helping her?
Yeah, true.
But it has to be an informed decision. You're not going to force. If the child doesn't want, you can't force. Yeah. Yes.
Wow, amazing. I think our viewers are glad to hear that. Sometimes you just accept that according to the ways of my child.
Yeah.
You just strike a discussion with them, and I believe that the children we are having today are not like the children we were then.
Yeah.
We can have such discussions with our parents and maybe take the necessary precautions where need be. Yes, without feeling stigmatized or
True.
feeling evil or something like that.
True.
Okay, I think that is so much of pills. We can continue with other methods of family planning.
So we have other methods. We have the injectables. In the streets, I think everyone knows them as Depot, the one we had taken, which are injected after 3 months. That is the most common one. So it has progesterone only, which is the only hormone. So it doesn't have as many side effects as the combined oral contraceptive pills. So the major issue it has, it's also effective because once you're done, you inject it once. At 3 months is when you remember, oh, I need to. So for someone who doesn't like taking drugs every day, that is the best form of family planning.
Yeah.
The other thing, the only thing it has, because it's a hormonal based family planning, sometimes it interferes with the normal menstrual cycle. So you find either you're having what you call it, intermenstrual bleeding in between menses. Either it's just spotting or mild bleeding, or sometimes you have periods have disappeared. For most ladies, I know that is the highlight of the year.
That would be the best.
Yeah. But sometimes you're worried if it has disappeared, what's
happening?
Yeah.
Where is it going?
And then you start wondering, am I pregnant? But once you understand the mechanism of the injectables, it becomes, it's normal. As long as you have to make sure you're not pregnant before you're injected.
Okay.
Yeah, because if you're injected and nothing much will happen, it's only that it won't be effective. I'm already pregnant.
When you're already pregnant and then you're injected, nothing will happen.
Nothing will happen to the baby.
Okay.
But now, your mind will be like, I'm not pregnant, but I'm pregnant.
Yeah.
So
you have to be tested.
You have to be tested to make sure you're not pregnant before you inject it.
That means every 3 months you have first to be tested.
Yeah.
Then you inject.
Yes.
Okay.
Yeah.
All right.
So that majorly the main issues, it's the irregular menses, as I've said, and the lack of periods. That is the major side effect it has.
And Daktari, you are assuring us that lack of periods is actually normal.
It is normal for the injectables and the implants.
Okay.
Yeah, it's normal. It happens.
All right.
Yeah.
I am talking that because what we talk outside here, I told you, I keep saying the general public to mean that we are the non-medics. When someone says they are using this type of family planning and somehow their menses disappeared, people will be like, that is not healthy. That is something that should cause an alarm. You should go back and...
The question they ask, where is the blood going? But then the question,
exactly.
But now what you're trying, for you to understand why you're having lack of blood, that is now the lack of period.
Yeah,
it's because now you're not. It's a very detailed physiology. I can try to soften it or
break it
down to during menses, during what you call ovulation. Once the body is preparing for pregnancy, there's the changes that occur in the uterus, which is the everyone knows what a uterus is.
True.
So it thickens to allow for to prepare for implantation. You need the fertilized egg to attach to the uterus, right? So now this hormonal family planning methods, they try to remove that element of the body preparing for implantation. So, and periods is that thickening, getting out to there's no implantation. Right?
Yes.
So if the uterus is not thickened, I won't bleed. Yeah, but I'm still having...
There's nothing that will be breaking.
Yeah, there's nothing that will be breaking out. So there will be no bleeding. So I'll be okay. It's not, there's nowhere where blood is accumulating. Yeah.
There's someone who once said, the day it will come, it will be an accumulation of all those months when it has not been coming. But I think right now it's more clearer.
Yeah.
And actually in a very basic way that we are understanding.
You see, even not because of that element why it causes you to lose your period. For those who have very heavy bleeding, you actually advise them to use that method because now it stops the bleeding. So I'm not at risk of getting anemia because of the heavy bleeding. It's an advantage.
Yes, true. And also for those who have very painful
the same.
Yes.
It's an advantage. Yeah.
Amazing. That is number 2.
So majorly implants, the injectables we've said mostly are for 3 months.
Yeah.
Then there's a newer one where you don't even have to go to the facility. You're taught how to use it and then you just inject yourself.
Oh, at home?
At home.
Okay.
Yeah. So you need to go to these facilities and learn these things so that if I feel like I don't want to, as long as you're not pregnant.
So you have to first
you have to
for
do that.
pregnancy yourself.
Yes.
Once you make sure you are not, you just inject yourself.
Yes.
Where do you inject yourself?
You're taught either the thighs or the stomach.
Oh,
you're taught in the facility how you're going to inject yourself.
Stomach sounds scary.
Okay, the abdomen.
Okay. Anywhere around that point sounds scary.
Okay, depending. Some people, you see, like the ones who are diabetics, who actually do insulin. So the same places the diabetics inject insulin is the same places. Or here.
Yes.
The upper thigh. Yeah.
In here.
Yeah.
The thigh.
Yes.
Okay.
So other than the injectables, we have implants. Majorly in the market, we have what you call Zadel. Zadel lasts 5 years. I think that is the one people know. And then there's the no plant for 3 years. So it's the same procedure. It's the same side effects as the injectables. They still give you irregular menses, the intermenstrual bleeding, sometimes, or even the lack of bleeding. But it's as long as the side effects are not as much, it's the patient to decide, is it working for me or not? If it's not working for me, then I go back to the hospital and tell them it's causing me to bleed too much. And then we can see what you're going to do about it. Yeah.
Okay. The bleeding in between menses, I am just thinking through. You see, some of the diseases can cause you to bleed in between menses. And sometimes, now when it is brought by family planning, you may not be sure whether, is this scary? Am I supposed to seek? Is it because of the family planning, or is it some signs of some kind of cervical cancer or something?
So what happens? That's why you really need, for all family planning methods, you have to sit down with a healthcare practitioner and discuss, so that you know this is what is expected. So normally, once you have started the family planning, the implant or the injectables, within the first 3 months, because you're introducing a new hormone into your body, that changes. So that is why when you get the irregular menses and the intermission, not all of them, not everyone gets it actually. Some it's a smooth sailing. You won't even know you have issues, but some it happens. So for the first 3 months, when the body is realigning to the implant, you might see these changes. Then they stabilize. But now if they persist and they worsen, like the bleeding, there's spotting and there's bleeding, like heavy bleeding, you know. So if it's heavy bleeding, that is an alarm. You need to go and see the healthcare practitioner. And then they'll tell you if it's normal or abnormal. But you don't decide at home that this is abnormal and you don't even know what's going on with your body. So if you see any issues, go and see.
Any issue of concern, you go back
go back to hospital.
We stop consulting each other.
Because you're lying to each other.
We are lying to each other.
Yes.
Yeah. So now those are hormonals. So far, everything you have.
Most of our family planning methods are hormonal.
Okay.
And then now we have the normal ones. We have the natural methods.
Okay.
Now natural, everyone knows. Every lady says safe days. You count your safe days and then another time with safe days. There's even a bracelet that shows you this is ovulation time. So from this time to this time, I'm able to do anything. Yeah. And then there's the interrupters. Withdrawal method. Sorry, men don't like it, but it's also a form of family planning.
Depends with what you agree with your partner.
Yeah, that is why we said it's a teamwork. Yeah. And then now we have the barrier methods. So barrier methods, we have the condoms. We have the male condoms and female condoms. Most people know about male condoms, but no one knows. Most ladies, yeah, they don't think about female condoms. And then, like for female condoms, it's advantageous because you can keep it in even hours before the activity. Yeah. Yeah. And then there's something called a diaphragm. There is some gel that kills sperms. There are different types of.
That's still to the female.
Yes. Yeah.
After or before?
Okay, so the gel is before, because after sperms will have already gone in, but the gel is supposed to kill the sperms. So you do it before. Yeah.
Okay, that's kind of new.
It's there. It's only that people don't know about it. Because it's invasive. You have to go in there and apply things, so
it's not comfortable.
It's not comfortable. Yeah.
That's why maybe it's not very popular.
Yeah. And then now we have the permanent. We have the long-acting ones. We have now the permanent and the coils, copper IUD coils. Yeah, we call them coils out here. So we have coils. There are two types: hormonal coils and the one that has copper. So it depends which one you're comfortable with. Both of them, at least 10 years down the line, you're still having
10 years.
Yeah. For the hormonal, up to 12 years. So you see, it's easy. It's you to make the decision.
You have so many choices.
It's you to make the decision. What do I want? What am I comfortable with? Then you discuss with the partner. Are we comfortable with this?
And here we are just assuming where the partner is there.
Yeah.
And there are times you need to agree on your own.
Yeah, in this generation, people don't have partners. Or they have multiple partners. It's possible.
Yes, very possible.
So it's you to decide which is comfortable for me. Which one will work best for me. Yeah. So you sit down with your healthcare provider, you discuss. Nowadays they have these two booklets that is summarized. It has pictures. You just go through it while discussing. It's actually given to the patient. You go through it, you discuss, and then you decide. And then it even gives you the advantages and disadvantages. Yeah.
So let me ask, if you are a first-time user of family planning, as you discuss with your practitioner, is it usually a method of trial and error, or is it automatic that after you give some history, some information, the doctor will automatically know, for you, we are going to use
it's not the doctor who decides for you. So what happens, that's I've said, is that booklet. It has all methods, from natural, barrier, hormonal, long-acting, all of them. So we go one by one discussing each and every method with demonstrations and pictures. It has pictures and side effects and everything. So by the time you have finished the end of that booklet, now I tell you, from what you have seen, what do you feel is comfortable for you? And then you tell me, I feel like I want to be remembering to take pills, so that one is not for me. I feel like this one is better for me. And then now we discuss about that one alone. I tell you, okay, from how I've seen you, maybe your weight, your age, I feel like this one is not maybe the best for you because of this and this and this, or if this is the best for you because of this and this and this. So it's a discussion. It has to be an informed discussion. Once you agree, now we go ahead and place the family planning.
Take for example, me as a patient, I have really talked to people out there, and everybody saying, just take coil, by the way, it will not give you weight gain, it will not cause bleeding abnormally and all that. And then I come to you and tell you, Doctor, I want the coil. And, I don't want a lot of discussion. So what do you do with that patient?
So we discuss about the pros and cons of the coil.
And then you give it to me.
if they, it's a discussion. If you decide, I can still give you other long acting methods. So a coil is a long acting, so I can discuss about other long acting, like now implants, because they're also long acting. I'll tell you there's also another alternative, an implant. And then we discuss about the both of them, and then you make a decision. Sometimes you actually ask, how do you know about coil? You tell us first your opinions, and then we'll go from there where we are coming from.
You know where to start.
Yeah.
Okay. That's amazing to hear. So let's talk about the general side effects of this family planning that actually make people fear and give a lot of maids outside here. Things like weight gain, things like you're saying abnormal bleeding, and especially weight gain is really feared out here.
Yeah.
Others talk about when you use these family planning methods, once you want to get a baby, you will have some delay, you will have some good time of waiting.
Yeah.
So there are those. I don't know how you can be able to generalize, or maybe
we can go one by one. It will be easier. Like we have talked about the irregular cycle, the heavy bleeding.
Yes.
So it's not all people who will get it.
Yeah.
It's different patients react differently to these forms of family planning.
Yeah.
So it's a matter of finding out, have you ever had a family planning method before?
Yeah.
How did it affect you? So most of these hormonal, the progestins, the injectables and the implants, because they have one hormone, progesterone, they tend to have this irregular bleeding and the intermenstrual bleeding and even the lack of periods. So if I feel like you've had this before, then I'll advise you more on the combined oral, because it has estrogen, which helps to counter the irregular. Because sometimes even when you go to the facility and you're on implant and you're bleeding, we actually give you combined oral with the pills, the family plan, the
so
pills.
they can regulate.
They can regulate the hormones. So it depends.
Okay, so you can actually classify them into hormonal and non-hormonal effects. That means you cannot, if the implant is affecting me, I cannot change to another hormonal method.
Most likely, what the effect that is the implant is giving you, this other hormonal, especially the injectable, might give you the same effect.
Oh, okay. Okay.
So maybe I'll advise you on an hormonal.
Okay.
So like a copper, the coil, copper IUD.
Yes.
That one will work better for the people who have issues with hormonal therapy. So it depends. And then it's not all patients. Some never even get this. So it's not actually, I had a friend who had, so even me I'm going to have. No, it's patient-centered.
Okay.
User dependent. You might have, it becomes smooth sailing from start to finish. And then you're like, once I get a baby, I'm going back to the same method because it worked for me.
So that means if one method is working for you, even after getting another baby, you're almost sure that this is the method that actually works for me.
So you can decide to continue with it.
Okay.
But if it doesn't work for you, you can change to another method.
Let's talk about delayed.
So we call it return to fertility.
Yes.
Right? So most like, let's use the coils. Coil return to fertility is immediate. Once I remove it, I'm able to conceive. Right? That is easy. Pills, as we've said, because the effective rate, as long as I take the pills well, I will not conceive.
Yes.
But if I miss them, return to fertility is immediate.
Oh.
Okay. So our delay comes with the implants and the injectables. So return to fertility takes 0 to 3 months.
Okay.
I mean 3 to 6 months. Sorry, 3 to 6 months. But then the depot, as long as I've been using it for more than a year, return to fertility takes long, up to a year.
Okay.
So it depends. Which method, like how long, when do I want this baby? If I want the baby immediately after I stop contraception, then some of these hormonal, the implants and the injectables might not be the best for me, because I want that baby immediately after I stop it.
Yes.
But if I'm like, I'm still deciding whether I want to conceive or not, then they're okay.
Okay.
Yeah.
So that means it's a very broad discussion that every person needs to have with their
Healthcare provider.
healthcare provider.
Yeah.
It's not just an issue of going over the counter and asking for pills or
Yes.
something.
Yeah, you have to sit down, discuss, understand, and then make the decision, the
Yes.
correct decision after you
Yes.
have been told
Mm.
the pros and cons, because it's all a matter of pros and cons.
Yeah.
It's not straightforward that
Yeah.
this one will work, this one won't work.
Or depending on what your friends, because outside here you hear so many of those discussions and people saying, for me, I used this, I delayed return to fertility 1 year, somebody else is saying 2 years, and now what
then
they
there's some
create is
who-
a very fearful way.
But then there's some who are like, I was even on Depo and I didn't know I was pregnant.
Exactly.
Yeah, so you see, it's a different.
So that
It depends
brings us-
with who you are talking to.
Exactly. So the best person it's a healthcare provider.
Yeah.
That's the best place you can get the right information.
Yes.
And that brings us to the failure rate
Mhm.
of these family planning methods.
So depending, as I've said, most of them, effectiveness is 99.5%.
So there is
Meaning
0.5.
failure rate is 0.5%.
Yeah.
Like for pills, as long as you're taking them the way they're supposed to, there's failure rate is 0.5%. But then now the natural one, now those ones failure rate is very low, so it's almost impossible to get pregnant unless you're already pregnant before you
used the methods.
Yeah. Because some people, you tell them first don't get pregnant, and then they tell you I did, it was negative, but maybe they didn't do it, and then they find they're pregnant. You see, so it depends.
Or they conceived last night. And
Yeah.
they're coming for the
And then they're coming for the when as long as you're using the urine test, you wait for at least 4 weeks, right, for it to turn positive. But if you want to be sure, you can use a blood test. But then who has time to do a blood work?
Actually, you're talking of blood, a urine test.
Yeah.
And people out here will be doing the urine test because they had unprotected sex yesterday night. So today they are feeling like,
Yes.
what if I got pregnant? So it's negative, and they're feeling happy.
Yeah.
I wasn't pregnant.
Until
So tomorrow,
until 1 month later, now they start experiencing symptoms, and then they're like, what's going on?
And tomorrow they're getting a depot or something.
Yeah.
Wow.
So and then now they come, they don't even know when I conceived, because you see,
because the last time they checked, they were negative.
Mm.
Dr. Sly, you have talked so much about female contraceptives, and I'm asking, do you have male contraceptives, or it just have to be the burden of women?
Yeah, we have male contraceptives. I remember condoms are associated with males, actually. Male condoms.
True.
So that is one form of male contraceptive. Then now there's the controversial one called vasectomy, which is a permanent one. Now that is where issues come with male and family planning when it comes to mentioning vasectomy. No one ever wants to do it. They just want the ladies to go through by the permanent one for ladies is bilateral tubal ligation, BTL.
What is that?
So what they do, because normally the egg is fertilized in the tube, so we're trying to prevent the passage of the fertilized egg to the uterus for implantation.
Yes.
So you're blocking that tube. So we are like getting it, we are cutting it off.
Okay.
So the egg won't have a way of getting to the uterus for implantation.
Yeah.
But it's a permanent one. There's no reversing it. Once you decide I have enough babies, this is final, I don't want any more, that is what we discuss.
Like permanent.
Permanent.
So
failure rate is
100%.
0.001.
Oh, okay.
Yeah. It's very hard to reverse it. As long as it's done correctly, it's very hard to reverse it.
Very hard or very impossible?
Almost impossible. Anything is possible in this world.
Yeah, true.
Almost
Science
impossible.
is evolving every day.
Yeah.
Yeah.
But that one, once it's a permanent. Once you decide this is it, there is no way expect you to get another baby.
Okay.
Yeah. So for males, vasectomy, they say as long as the lady doesn't know the male has done vasectomy, she'll still get pregnant. That is the joke. So
So the men don't want to be known that they have done it.
Yeah, because I don't know why they fear it. They have to tell us. We try to talk to them, but in all my years of practicing as a obs guy, and I've never seen a vasectomy being done. That is how serious it is. Yeah.
Well, maybe the next time we are having a male as a guest,
Yeah.
that's a question we should ask.
True.
Yes. Okay. As far as family planning is concerned, I think we have been able to touch the basics and what we need to hear from outside here. But then there is one more thing. It is also a very controversial topic. In as much as we are talking like it's an obvious thing out here. Because I believe there are some religions that do not, I know there are some religions that are so much against contraceptives. Maybe with a belief that it is a form of abortion or something. So I don't know how you as a medical practitioner, you go about it, and especially in your department, and how these cases come to you.
So, religion, in everything, religion plays an important role.
Yeah.
So the religious aspects where family planning is against is not contraindicated. It's like it's preached against because they believe it's a form of abortion.
Yeah.
You can't change someone's religious views. So you just handle them the way they come to you.
Okay.
So if they decide I don't want any form of family planning, now you advise them on the natural methods, or the barrier methods, because that's not a form of abortion. It's not a form of abortion. They try also to explain these other methods, but normally you just advise. It's all a matter of advice. You give the advice. The patient decides to take it, they will. If they decide against it, you have given the information. They have the information. It's up to them to decide what they want to do with it. Yeah, but natural helps. Just you advise them on the different forms of natural methods, because that is not a way off.
It's not like doing an abortion.
Yeah,
according to the way
they believe.
Do you think it is?
I'm a scientist, so I wouldn't say yes or no.
I have put in a corner.
Yeah. Now I'm a scientist. I'm not in religion anymore. Yeah.
So you would not want to really say outrightly if it is or it's not.
I don't believe it's a form of abortion. Because for a baby, for a fetus, now the fertilized egg evolves, becomes an embryo, a fetus.
Zygote.
For me to say it's an abortion, that baby should have been able to survive once they had been born, right? But if it's at 8 weeks old and it comes out spontaneously, right? That is an abortion. But it wasn't forced. It happened on its own. So, we have not even fertilized this egg. We are preventing that egg from being fertilized. So how is it an abortion? We have not formed anything. That is my view.
So fertilization has not taken place, so no formation has
so there's no embryo, there's no fetus, so there's no way.
That is from the scientific side of you.
So I'm not committing an abortion.
Okay. I don't want to ask how it happens in the religion-based hospitals, because we have
what they do, they advise the patients. It's the same. We give the advice. If they want family planning, they go to a facility that provides for them. Yeah.
Do you have scenarios? Now this is an interesting question out of the place. Do you have scenarios where someone who has strongly stood against family planning because of their religion stand, but then they get unwanted pregnancy, maybe a baby after another, and now they're coming to you crying for help, something like that.
Yeah. So now you can't tell them I told you so. You can't. You have to be professional. So what you do, you just advise, this is what has happened. Whatever you're going through is normal. It happens. So this is what you're going to do about it. You have to be professional. You can't say I told you so, because now it will be like rubbing salt to an injury.
Yeah, true.
It won't help anyone. So you just have to be patient with the patient, make them understand why we really need family planning, why it's important for her or for them as a family. And now you have backup. You have proof why we needed it at that time, but we don't have. We weren't at the same level. Yeah, so it becomes easier once you have undergone a bad experience to understand why it's important for you to listen to your healthcare provider. Yes.
The last one, do you experience scenarios where we have said this is a shared issue between partners, where someone comes and tells you, I am taking this family planning, but my partner should not know. And is it just allowed? It's just fine as long as it is a decision of the person taking the family plan.
Who is the patient? Is it the partner or the one who is in front of you?
The one in front of you.
So if they don't want to disclose to the partner, I have that patient-doctor confidentiality that I should not tell the partner that they have done this, right? Because then at times men don't. I don't know. They're against family planning. I don't know why. Sometimes I don't know why. So it's about the patient and the doctor. So if the lady is like, no, I'm going to place this, but don't tell my husband, she has that right to ask. As long as she has that right. There's that confidentiality. So you do it, she will disclose it eventually. If she doesn't, you can do couples therapy after, maybe.
Wow, that's quite interesting. I think the part of men is majorly maybe they do not want to take the responsibility of now carrying
They should, because most times they're the instigators of these sexual activities and intercourse, right?
True.
They're the ones who decide I want this number of children, right? But not at the expense of the lady. So it has to be, they have to understand a lady is not just for producing. She's also important for other aspects. Right?
Very true. Very, very true.
So
that's a good message to the men out there.
So it's all a matter of teamwork. But if there's no teamwork, as a lady, you have to take responsibility for your life.
So majorly what we can say and what we can speak to the ladies out there, family planning, it is supposed to be a shared burden. But how it has come over time, it is the burden of the lady. And because you're the one to carry the responsibilities, just go for it where you feel there is a need. Yes. Just go for it. I think as a discussion we can have for many, many hours, but because of time, and as we also wait for the questions that will come from our viewers, we will now address them in our next episodes of family planning. We are glad to have you. Thank you so much. You have given us a very, very interesting and very rich information that I believe that our viewers will love and will relate with. And in case you have questions, please always write them down in the comment sections and in all our social media handles. We will always address them. So thank you so much, Dr. Sly. We are glad to have you. We look forward to having you once again, and as many times as possible in this studio. To my viewers, I really apologize today. I have some flu, but I believe we have enjoyed our time together, and this is a show where we break down medical jargon into simple, relatable, and consumable dosage. I believe today we have had the right dosage.
And as we all agreed, this is a show born out of purpose. Be part of this purpose by liking, sharing, subscribing, and commenting. Until next time, let's keep the health conversation going, because health is life and health is human.